Now, you know the song, boots are made for walking, not for covering up unsightly varicose and spider veins. And Dr. Robert Cutchen is the founder and medical director of the Albuquerque Vein and Laser Institute, and he can keep you moving. Good morning, Dr. Cutchen.
Good morning. It's good to be here.
It's good to have you back. Happy holiday season to you. And you know, I want to get started for those who don't know by explaining what a varicose vein actually is.
That's good. We're going to talk about varicose veins, spider veins, and facial spider veins today. But let's real quickly talk about what varicose veins are.
Okay.
I brought 3 little graphics to show.
Great.
The job of our veins is to carry the blood back up to our heart when we're talking about our legs. The blood should only flow up. So inside of our veins, we have these little valves that open to let the blood flow up towards our heart.
Okay.
And then gravity, of course, is always working against us and pulling the blood down. So these valves snap closed, and that prevents the blood from flowing back towards our toes. But in a varicose vein, the valves are broken, so the blood flows right back down that vein towards your feet. And that puts a lot of back pressure in the vein and can make them bulge out. And all that back pressure is what causes the pain, the heavy, tired, achy feeling of varicose veins.
Right, and there's really nothing we can do about gravity. That's just a fact of life. Now, what about when we talk about spider veins, so we can differentiate for our viewers?
So the spider veins are those real small, very fine veins. They can be red, they can be bluish or purplish, and those are just the very fine veins. And typically they don't cause a lot of discomfort. They're mostly unsightly.
Right, but they just sometimes bother you if you're, let me say, vain.
That's true.
Now, let's talk about the treatment, because if we talk about a problem, we always want a solution.
Right.
So how are varicose veins actually treated?
The good thing is the treatment for varicose veins has changed dramatically in the past decade, really.
Okay.
Everything we do now is done in the office, local anesthesia. There's no more going into the hospital, no more being asleep with a breathing tube down your throat.
What a relief.
Veins that were previously treated with stripping, we actually now close with a laser that we put inside the vein.
Okay.
Other veins are treated with injections, and other veins we actually pull out through little tiny incisions that are about 1/8 of an inch long.
And what I like is you've told me in the past is that you don't have to worry about a whole day. You don't have to worry about staying somewhere and having recovery time. I mean, really, you could do this on a lunch break, and you can start your day over again later on.
Yeah, our varicose vein treatments are typically about an hour long.
It's not bad at all.
And we send you on a walk immediately after we're done.
And what about spider veins? How are they treated?
The best way to treat spider veins is with sclerotherapy. And sclerotherapy, I brought a little video to show you, is when we inject veins with a very tiny needle and a liquid chemical. This liquid chemical chemically damages the vein and closes it down and makes the vein disappear. Now in this video, the vein's going to disappear just for a second. When we put the chemical in there, it's going to reappear, and it's going to slowly fade over the course of weeks to months. Weeks to months.
Okay, so the actual treatment, very quick. You actually see an immediate response, but then it takes an actual few weeks to months before it really disappears for good.
For your body kind of chews that up and just kind of makes it disappear.
Okay, now we're talking about something else that we haven't really discussed yet. You mentioned facial veins, and I think that's really interesting to talk about, because I don't think a lot of people, who are experiencing that realize that that is actually something a lot of people are going through, is dealing with facial spider veins.
It really is common, and we see it in women and in men, and it bothers everybody. And most commonly, people will get veins kind of on the bridges and kind of on the side of their nose, and even onto their cheeks. And for a lot of people, it just really bothers them cosmetically, and they kind of worry about it.
Absolutely, but it's not something that's not something uncommon. It's not just unique. So if you're going through this, you may want to understand, how can I treat that? So what would be the solution in a situation
We've got a really neat new technology, and it's called VeinWave.
VeinWave,
and VeinWave is it's a technology that's been used in Europe for about 13 years. It's been FDA approved in the United States for about since 2009.
Okay.
And there's a little video here showing it is basically a kind of a handheld device you hold with a little foot pedal. It's a very tiny needle, and essentially you almost just kind of touch these veins. You're not injecting them, you're just touching them with this little needle.
Okay.
And you step on a little foot pedal, and it delivers some radio frequency energy in there. It kind of zaps the vein and closes it down.
Okay.
And the great thing about it is you don't have to use any sort of anesthetic. It kind of feels like just a little kind of a little pinprick is kind of what it feels like.
Okay.
And it works really well. It was equally good on men and women. Like I said, no local anesthetic. On facial treatments, it's very fast. The veins really fade very quickly.
Really? Is there recovery time or downtime?
When we can use it on the face and on very fine leg veins, and we'll use the VeinWave on veins that are essentially too small to get a needle into. Sclerotherapy is the best, but for very, very fine veins, This is a great technology.
Vein Wave.
The Vein Wave is a great technology, and I brought a few before and after
pictures. Yeah, I was just going to
too.
say, let's take a look at those, because that's really where you can get the effect.
And you can see kind of these really small veins, and they fade very quickly, very nicely.
What a difference.
And I had it done on one side of my nose, so I look really good on one side of my nose, and one side of my nose I don't look as good. But you can see how it works really well.
Oh my gosh.
And it's just a neat new technology that we're excited to have in our office.
Dr. Cutchen, that's a dramatic difference. I mean, that's a dramatic difference.
It really is. It's neat.
Amazing. So it's a wonderful thing and a wonderful comfort for people out there who are dealing with this and want to know how to find a solution. And we're so glad that you actually have a free vein screening as well. That's going to be on December 13th. Can you tell us real quickly what's involved?
And our free vein screening events are really more for patients who are wondering about the larger varicose veins. And it gives patients an opportunity to come in and meet with me for about 10 minutes, take a look at their legs, and try to just give them a quick idea if we're looking at more of a cosmetic problem, spider veins, or more of a medical problem that we're actually going to bill to insurance.
And to have a professional help assess that is certainly comforting. Thank you so much, Dr. Cutchen. We really appreciate your help.
Thank you so much.
And don't go away, because mothers and daughters have their ups and downs. Coming up next, I'm talking to Jamie Presley and Katie Finneran, stars of Fox's new hit sitcom, I Hate My Teenage Daughter. It will be a hit, sure.
Oh, God, here she comes. She's with that other one.